Hello viewers, my name is Andrew Dean, Vice President of Research and Innovation at Lakehead University, inviting you to another edition of Research Matters. And today we're going to meet with Dr. Aislin Mushquash, an Associate Professor in the Department of Psychology at Lakehead University. Dr. Mushquash is also a Clinical Psychologist with Dilico Anishinabek Family Care, where she provides assessment, intervention, and consultation to support First Nation children, youth, adults, and families. Welcome, Aislin. So we're really pleased to have you join us today. Could you perhaps share with the viewers your research interests and how they fit in with your roles as both a professor and a clinical psychologist?
Sure. Thanks so much for having me here. It's great to chat about these things. So my research generally focuses on stress and coping. And so we tend to look at this in a few different ways. We have some lab-based research that's going on that we really try to understand how and why people cope in the ways that they do. So oftentimes, I think when we reflect on our own coping, we might think that in a future situation, we're going to handle something really well. But then when the situation actually arises, how do we interact? How do we engage in the situation? How do we cope with it in the moment? So we're really trying to understand what predicts if people are going to cope well, what predicts if people are not going to cope well. And then the other area of our research is really more focused on if people need some support in building up their coping strategies, how can we explore different types of supports for them? So can we be innovative? Can we look to technology potentially as a tool to support people as they're learning about more adaptive coping strategies that can be helpful as they navigate the stressors that we all face throughout life? So I really see the work that I do as a psychologist clinically really mirrors what we do in our research as well. So oftentimes as a psychologist, you sit down, you meet with someone one-on-one, and you really try to understand what's going on for them. What are their main stressors? How are they managing it? What's working for them? What's not? And we kind of do that in the lab and in our community-based research, but on a larger scale to try to understand as groups of people, how do we cope with situations? And then looking to have that inform practice. So eventually hoping that it will have an impact on how psychologists or clinicians are able to best serve the community that we work with here in Northwestern Ontario.
That's great.
Yeah.
I know our viewers and myself actually are always very interested how someone gets into a path. How did they, what was it with their undergraduate? What was their interest as a child maybe that led them into this form of research? So can you tell us your journey to become this kind of research?
Yeah. So I was always interested in some kind of maladaptive behaviors, why people engage in them, and especially behaviors when I was doing my own PhD. I was having a look at behaviors that someone might engage in that they think helps in the short term, but then ultimately keeps them stuck in this cycle, this like maladaptive cycle. So I started out studying things like binge eating, binge drinking, procrastination, and really trying to understand the role that personality traits have on these coping behaviors. So that's kind of where I started. And then from there, that's sort of adapted to looking at other personality traits, looking at early experiences people have had, because obviously we don't exist in a vacuum. So there's influences that we have as we are growing up that impact, how do I learn about when I am stressed at work or school? How do I deal with that? How does mom deal with that? How do my friends deal with that? How do grandma and grandpa deal with that? So looking at the roles of these early role models and early experiences, because we know that people don't just exist themselves in a situation. So trying to take that bigger social lens as well, the role of others. And then I think, being and living in Northwestern Ontario, when we look to see resources that people have to support them along their journey towards improved health and mental health, we're often in a situation here where the needs of people in our community surpass the availability of resources in the community. So I think for me, moving more towards the applied side of research has really been driven by working clinically in the community and seeing the needs and knowing that we need to kind of think outside the box, be creative, innovative, to look at tools that can help make sure that we really are tailoring our approach to specific clients' needs, but also being creative and thinking about how we can leverage new technologies, things like apps, we'll talk about a bit later, that might help to give people the support they need in the moment, so they're not having to just wait till when they finally reached out for help.
So your research really goes the whole spectrum. I know quite often in today's world we often talk about treating the symptoms, like if somebody has binge drinking or something, what can they do at that point? But I think also your research, correct me if I'm wrong, really looks also at the causes of the problems. You know, why do people have these kind of things? What are some of the traits that keep those triggers going rather than just simply correcting the symptoms?
For sure, yeah. And we kind of talk about things as being transdiagnostic sometimes, right? So rather than, you know, someone comes in and you treat depression, exactly what you were just mentioning, we look at like what are the underlying factors that maintain someone's low mood. And that could be something that contributes to anxiety, to depression, to substance use, to eating difficulties, relationship problems. So going after coping strategies can help across these various presentations of difficulties or mental health challenges that we see for people, for sure.
So you've already talked a little bit about it, but can you also maybe some of the ongoing projects that you're currently working on?
Yeah, so I'm fortunate to work with a really great group of graduate students. So in our lab, we do some lab-based work like I talked about. So some of the studies that we have going on are looking at daily stress and coping for people. So we're kind of moving beyond in the literature, in the field. What has been done to date is like you would just give someone a questionnaire and say, if you were faced with a stressor, how might you cope? And so we're kind of projecting out how we might cope with a situation if it were to occur. But there's real limitations to that, because if I were to think, okay, if I was stressed at work and I have looming deadlines, like I think I would cope pretty well. I would reach out for social support. I might go for a walk. But in the heat of the moment, when you are actually faced with those deadlines, what do you actually do in those moments? So we have been running this daily study where we ask people to report on their daily stressors for 14 days, and then also ask them to report on how they cope with those stressors across those 2 weeks to really get a good understanding of which coping strategies do they use in paired with each type of stressor. So financial stress, work, relationship stress, any other kind of stressors that they're faced with, to really understand how are they paired, and then what are the risk factors for certain people, whether it's personality-based or based on their early life experiences, early adversity that people may have had that might make them more at risk for some of the more challenging coping strategies. So that's some of the kind of lab-based work we have going on. I know one of my graduate students later will talk about her work in that area as well. And then we have some projects in the community going on in collaboration with multiple different community organizations where we're looking at evaluating and implementing a smartphone app called JoyPop to see if this can be a useful tool for youth, kind of ranging from age 12 all the way up to age 25, a tool to help them build up their emotion regulation skills. So we know that deficits in emotion regulation do underlie a lot of mental health difficulties. So it is one of those transdiagnostic factors. So we're looking to see, can the app be a tool that can help people learn more about emotions, how to manage their emotions, and how that can be useful as they're navigating the stressors and the things that they face in their life.
Well, I want to thank you for introducing your research. This has already been really super fascinating. We're going to take a very short break now, and we'll be right back with our discussions with Aislin to learn more about the JoyPop app, which you just referred to a little about using some more technology as going forward, and how it's being used to support mental health. Welcome back, everybody. So you're watching Research Matters, brought to you by Lakehead University. Aislin, before the break, you mentioned that your lab is testing a smartphone app called JoyPop. Can you tell us a bit more about it?
Sure. So JoyPop was developed in collaboration with clinicians, researchers, and youth to try to come up with something that could be a useful tool to support the development or maintenance of positive emotion regulation skills. So when we think about emotion regulation, really what that means is trying to understand your emotions, and then if emotions are contributing to difficulties in your life, how to work through those, how to manage those. So the JoyPop app has features that include a mood rating where you can indicate how you're feeling. You kind of scroll up on a happiness face that says how happy you're feeling, and then rate some other moods. From there, depending on how moods are rated, then the user can be directed to other resources within the app that we know can support emotion regulation. So things like journaling, distraction activities. So there's games in there. There's an art feature for some people who might want to express themselves more artistically rather than through words. There's something called the circle of trust in there where they would input contact members that they could get in touch with if they were feeling upset or needed to reach out for some support. Then it also connects them with established helplines if they did need more support than the app could actually provide. So my research team kind of got involved in evaluating this back in 2017. So we've been working with the app for about six years or so. And first we started with a pilot study with university students to try to understand, could this be a helpful tool as people transition, in a stressful time as they transition into post-secondary education. So through that pilot study, we found positive results that using the app over a course of a month contributed to positive reductions in mental health symptoms and improvements in emotion regulation skills. And we found that it was particularly beneficial for people who had experienced more early adversity in their life, so more trauma, more abuse, neglect, household dysfunction. It actually was more helpful, and they saw a faster improvement in their emotion regulation skills than for folks that had less of these experiences. So with those positive results, we were able to connect with our community partners to look to their needs, and they were really at a time where they're wanting to explore e-mental health or innovative kind of technology-based tools as a resource to support the youth that they serve. So it just worked out well that we were kind of publishing these results that were promising, and they were looking to find something that might fill a gap in terms of technology as an add-on support. And so we were able to seek out some funding through the Thunder Bay Community Foundation, a small pilot grant to do a pilot study with Children's Center Thunder Bay and Dilico Anishinabek Family Care. And through that pilot study, we saw that youth were really interested in using the app. The clinicians that we worked with thought it could be a helpful tool before treatment, during treatment, and even as a discharge recommendation. And so that pilot study went on from, I think, about 2020 to 2021. And with those positive results, we were able to seek out some more funding through CIHR and Sick Kids Foundation and Brain Canada to do a randomized control trial, which is ongoing now. And in the randomized control trial, we're really trying to understand the app as a tool, a waitlist tool for youth that are waiting for supports at these agencies. So can this be something that they use rather than just sitting on the wait list? Can this be something that they use to start learning about their emotions, thinking about their emotions, managing their emotions prior to getting in to see someone for counseling? So that's kind of where we're at right now with our clinical partners, where we also just expanded out to work with Thunder Bay Counseling and St. Joseph's Care Group for youth on their wait lists. And then we have another study at Lakehead going on where we're looking at the app less as a waitlist tool, but more as a health promotion or mental health prevention kind of tool. So giving it to all university students in a randomized control trial again, where we can determine for university students that do get access to the app, do they see better outcomes in terms of their ability to manage their well-being, because that's obviously a priority on campus to support student well-being as well. And I know Angela, one of my other students, will talk about another Joy Pop project we have going on with Children's Center. So I'll leave that for her to chat about. But yeah, it's been an exciting time and a nice way to connect with the community and feel like we're filling an important gap and addressing a need of the community in an important way.
Well, certainly, as you said, much of your work is with youth. I mean, connecting whether smartphones or an app is probably a very, very, I would say, positive approach, actually. And you mentioned about, seeing whether results or evaluation. Is that done through the app, or is that done through consultations afterwards with a psychologist?
Yeah, both. So we have some questionnaires that we give people before they ever start using the app. That's kind of our main outcome measure, and then they do that after they use the app for 2 weeks. They do it again after they use the app for a month. But we also get consultation, both qualitatively and quantitatively, from staff that they work with, from the youth themselves, to see have they found benefit, is the app acceptable to them? Because even if it has all the data in the world to support it as being effective, if somebody doesn't like it, if the youth don't like interfacing with it, they're not going to use it. So we've really tried to take this multi-method approach where we're getting good kind of quantitative number-based data to show that scores improve in terms of mental health and emotion regulation, but also that people like it and enjoy it and want to actually keep using it.
sounds like your community partners are integral to the success of your research. Can you tell me about some of the partners and also how these relationships develop and how you keep them going?
For sure, yeah. So our main partners that we've worked with to date are Children's Center, Thunder Bay, and Dilico Anishinabek Family Care. And then, like I said, just bringing on Thunder Bay Counseling Center and St. Joseph's Care Group, their mental health outpatient programs. So I think in terms of developing the relationship and being able to work with them on research objectives, it really is a slow process, and really taking the time to build the relationship first has been helpful. So taking our time with that and really trying to get to know the needs and the structure and the flow of their program, and then determining as researchers, do we have a skill set or an expertise that we could bring to help fill the needs and the gaps of a research question that they might have but not have the capacity necessarily to address internally on their teams. And we tried to incorporate what we call integrated knowledge translation, so involving them along the way in shaping the research objectives, figuring out what our goals are of these projects, involving them in like recruitment efforts. We've created project videos where youth and community partners like clinicians or program directors have been involved in our videos to show that there's support for this in the organization. And just taking our time with it, I think, has really been the most beneficial. And that, that sometimes presents challenges with grant deadlines or project deadlines, but I think it really makes all the difference in having a project and a partnership that's sustainable, and that there's trust and reciprocity between our team and the organizations and the people that they serve.
That sounds wonderful. Well, certainly there's, I think, a tremendous need in our community in Northwestern Ontario for understanding about mental health issues. What is that? How does it vary from one community to another? What are some of the more, I guess, novel approaches to it? Do you feel some success in some of the projects you've been doing?
Yeah, for sure. I think, we've seen even in our pilot study, the level of engagement of partners and youth in our studies is a lot higher than we've seen in the literature. So even to date for our randomized control trial, we've had 100% retention, and that's unheard of really in intervention studies. So I think really this approach has paid off in terms of engagement of our partners and engagement of youth once they, start being involved in the study. And it feels great to know that, this partnership is authentic and that we're able to figure things out together and create a plan that is most meaningful and that fits and connects with what partners want and what youth are needing.
Okay, we're going to take another short break and we'll be right back after to continue our discussions with Dr. Mushquash and some of her graduate students. Welcome back, everybody. So in this segment, we'll be joined by Angela Ashley, a master's student in clinical psychology, and Angela MacIsaac, a PhD student in clinical psychology. So thank you both for being here, Angela and Angela. Makes it easy. Please share your background, academic background, and your current research with our audience.
Yeah, I'll go ahead. So I did my undergraduate degree in psychology at the University of Toronto, and then came here to Lakehead to complete my master's degree in clinical psychology and supervised by Dr. Mushquash. So my research at that time was really one of the more initial evaluations of the Joypop app that Aislin's already talked about. So it's great to kind of see that turn into some larger scale RCTs and other projects. Currently, I've shifted gears a little bit in terms of my interests for my PhD. So I'm really interested right now in something referred to as trait victimhood. So this is really the finding that some individuals tend to sort of see themselves as victims across different interpersonal relationships, so might perceive more offenses or feel hurt more often than others, and really spend a lot of time thinking about this hurt and the sort of justice that they're deserved. So kind of in everyday terms, you might see this referred to as like playing the victim. In an everyday sense of things. And so I'm really interested in what sort of makes sense about this behavior from a psychological perspective. So as Aislin was talking about earlier, really looking at everyday behavior. So do individuals who score really high on this trait actually experience more interpersonal stress and conflict on a day-to-day basis? Or is it really something that's grounded in perception and belief that that's the case? And also looking at how this trait ties to a history of experiencing things like trauma in one's past, or other domains of victimization, and whether this trait might sort of mimic the kind of psychological response we see to things like trauma. So overall, just really interested in understanding what it means to strongly identify with things like victimhood and trauma, and if there's negative outcomes associated with it, how do we kind of acknowledge suffering in a mental health context while also not wanting to endorse some of those negative outcomes that we might see. So yeah, that's what I'm currently interested in.
Thank you. So yeah, I'm also Angela. I did my undergraduate degree at the University of Guelph, and I did it in psychology with a minor in neuroscience. So when I graduated from there, I became more interested in studying families and youth. So I ended up working as a research assistant and associate with the Family Psychology Center in Toronto with the Emotion Transformation Institute. And it was here that I got to study more of youth and families in the context of accessible mental health interventions, and looking at emotion regulation, coping, and resiliency. And from there, I became interested in Aislin's work and the lab, and I was able to join them to pursue my interests, which was for my master's thesis now, which I'm going to be working with Children's Center Thunder Bay, where we're going to be studying the use of the JoyPop app to see how it can be used as an additional resource alongside mental health services for youth, to see how it can just work towards helping them towards emotion regulation, as well as promoting positive mental health outcomes for them as well.
Well, these are both really interesting journeys and projects, and maybe you could just give us an idea of maybe Angela one. What are some of the things that would be most helpful for you to be as a researcher in the lab and at Lakehead University?
Yeah, I think one thing that's been really helpful so far is just having a really busy and productive lab environment, and a little bit of a larger lab group that we have going. So lots of the lab members are just very supportive and offer a lot of feedback, whether it's through practicing conference presentations in front of each other, just sharing resources related to our research, so methodological resources or data analysis resources. Just the lab environment itself has been really helpful so far. And with that, too, having a bit of a larger lab, there's often opportunities to supervise some of the more junior students in their research projects or help out with that. So as now more of a senior student myself, that's something that I've really benefited from as well, taking a little bit more of that leadership or project management sort of role. I think another thing that's been really helpful as well is just having faculty members or more senior researchers, whether it be through serving on my thesis committee or through other roles, just demonstrate the ability to offer really constructive criticism, and also demonstrate how to thoughtfully respond to that criticism in a way that shows that that aspect of research is really important for producing high quality work. I think too, another thing that happens sometimes in the social sciences is it's very easy to feel attached to your hypotheses and your research areas. And so researchers who've demonstrated just the ability to have their work challenged or go where the results and the data really takes them, even if a hypothesis isn't supported. I think that's really important to research, to producing high quality research. And I think maybe the last thing I'll say that's been really helpful too is just having a supervisor who's just really focused on mentorship and professional development of her students. So whether it's just through passing on different opportunities that would be good for our professional growth to be involved in, and just being open to research areas that we might be interested in, even if it maybe isn't something that the lab has specifically focused on more fully before, or something that's a little unconventional or a newer area. I think having that sort of support as a student has been really helpful so
That's
far.
wonderful. Mm-hmm. Yeah, I remember when colleague I worked with, he was not every hypothesis is true. And part of it is being able to accept that that is the case.
Right.
Okay.
Yeah, exactly.
Hey, Angela, your project involves collaboration with local children's mental health agencies. What would you say are some of the benefits and challenges of working with such agencies?
Yeah, I think just doing like community-based research in general just is able to have engage youth much more directly and impactfully than doing like lab-based research, because you're actually able to work within the community and with community members to actually see what their direct needs are within practice and be able to work with them to see what they want to see and what was best for them and what's not. So you can work with them to do interviews and feedback, to ask questions about, what do you like, what do you don't like, and you can do that right from the viewpoints of the youth as well as the service providers that you're trying to support. And while doing community-based research can sometimes be challenging in terms of the longer-term studies that we're doing, just to get participation and engagement continued throughout the study. It does really help to have supervisors like Aislin and awesome research collaborators at these organizations who are very enthusiastic about the process. And it gets us the ability to bring that evidence-based research back to app developers to be able to make the necessary changes that are actually going to benefit the youth who are currently using it and will use it in the future, for the Joy Pop app in particular. And we're finding that these types of relationships that we're building, it allows us to work with the service providers, the organizations, and the youth participants to actually co-develop these projects that will be beneficial for everyone in the mix. And, we're making sure that we're putting their opinions at the forefront. We're not just coming in with our own agenda as to what we want to do as researchers, but instead we're sharing that and working together towards that collaboration of what we want to achieve.
Well, thank you both very much for sharing your experiences. It sounds like you work in a very collaborative and collegial environment in the lab. Aislin, where can we find a little bit more information about your research projects?
Yeah, you can check out our website. We have links to ongoing projects, so just aislinmushquash.com. And then if you search Joy Pop, even in Google, you'll find some of our project videos, YouTube clips about the app in general, and anyone can reach out if there's any questions and wants to discuss any of the findings or potential collaborations.
Great, good. Well, I want to thank both of you for being here today and sharing your experience, and certainly for you, Aislin, as well. So improving access to mental health services is an important issue in Northern Ontario, particularly in more remote areas of our regions. Dr. Mushquash's research on the Joy Pop app and the integration of her work with community mental health service organizations is a significant step towards making mental health support more available and accessible to all. Again, thank you very much for being with us today for Research Matters at Lakehead University. And until next time, I'm Andrew Dean, Vice President of Research and Innovation at the university. Thank you.